I'm doing that because the guy that's now editing the videos, I don't know if he'll use that somehow, but this is week in review 43. This is the second to last week of March, and we said we're going to do these until end of April, and then we'll take a break for the summer because May gets super busy, and then
I forgot we said that.
Yeah, we'll see. Maybe we'll do them more sparse than maybe one a month. I don't know. Maybe we'll just keep going. Don't know. Maybe if we get enough fan feedback, subscribers, reviews, sponsorship money, we'll just keep going. I don't know. Updates. What's new with the team? I got a wild hair at my ass, and we're putting a golf simulator in the front office. We moved the recovery room, which I actually like better. Yeah, so now at the farm, you'll be able to come hit golf balls, especially on a day like this. It's like 40-mile-per-hour winds. Last night, in the middle of the night, the wind kicked up. I thought our house was going to fall down first of all. It started creaking and like.
Did it really get windy last night?
Yeah. And then
somehow our house is still standing.
We have a big metal.
I didn't hear it at all.
Yeah, we have a big movable metal barrier thing so people can't see me like showering from the next door neighbor. And I just hear that thing. Wow. And then Maddox is like, ah! Bill and I was like, oh, cool. I didn't even know it was supposed to storm. But,
I didn't even know it was supposed to rain. I just woke up this morning and it was
I didn't.
Well, it's 30 degrees.
Yeah, it rained.
It's like 30 degrees less than.
Outside, yeah.
So if the weather's like that, you'll be able to come to the farm, hit some golf balls, get some golf swing analysis, movement analysis, and then we'll probably, I don't know for sure, so I hope I'm not speaking out of both sides of my mouth here, but doing a little bit more work with the Blackburn Performance Center out at Greystone in terms of what we're doing with our golfers. So look forward to more of that. Other updates.
We survived a tornado.
Well, yeah. I mean, I'm not saying I mean, nothing was around us.
The threat.
Yeah. So
there were a few, but no.
So as everybody sans me was in our garage with helmets on. I think Sloan had on my climbing helmet.
He forgot his helmet.
Well, probably didn't help.
He goes, anyway. You showed up with the helmet. I was like, that's what they said to do.
I got a picture of Alex in a helmet, and I just know his birthday's coming up next week. And if he says one more crack at me, I'm just telling you right now, he's going to rue the day.
I think the cracks at you versus me, that might be my third, and you're talking triple digits probably.
Did you just stutter?
That's why he needs a helmet. He's got a soft spot. If he gets it one more time, the stutter goes into full, can't speak. But no, the cell was right over the polygon. Was right over us.
The polygonies.
If I had to hear that one more time, I just wanted to watch. I just wanted to watch the Players Championship, and I had to hear the polygon 18 times. And then I heard James Spann's underling, the younger guy, say, "Well, is it turns into night? It's going to get dark. It's going to make it hard to see those storms." Can you imagine if somebody came in and I go,
"It's going to be dark."
Hey, I hear your back hurts. And they're like, "Yeah." I go, "Guess what? I'm guessing that your back's been hurting you, huh?" Like what the?
I bet if you go to sleep, you're not going to feel it.
Yeah. Cool. Thanks for the info there, bro. But anyways, the cell was right over us. No wind, no rain.
That's crazy. Weird. Yeah, we had
literally when it was supposed to be the worst, nothing. And then it, rain and stuff. And there were tornadoes around us, and I know there were casualties and stuff, so I'm not trying to downplay it. Yeah. But around us, it was not much. But it's storm season, so.
We heard him saying it was headed towards the Narrows, and I said, well, hope we have work on Monday.
So what was it? 2023 was that one that ripped over?
We weren't here yet. So that was probably 2020.
We were in a different office
21.
building in the same little area. 21. And I'm from Illinois, so you can see a tornado in Illinois coming here. They're what's called rain wrapped. So it's just like in this massive storm. And Oak Mountain is right behind our office here. And we had patients in the office, and the lights are going off and on, and then the power goes out. And I was like, okay, I guess we can kind of look if the storm's coming. And I opened the back door, and I can't remember what patient was standing right next to me, and you could see the tornado going like across the top of the mountain. And I was like, well, I thought tornadoes wouldn't go across mountains. And it just literally ripped over the top of Double Oak Mountain and went up and down some mountains for like 3 miles out to Highway 43.
All right,
while Sloan at that point, house with no basement, was in our closet with Maddox and her at the time with helmets on, and it was heading towards our house. And then it just took a left turn up the highway. So yeah, pretty wild. So
we used to hop back on the highway.
It went straight down 43 for it was wild driving down 43. I mean, it was just like,
the tornado knows how to drive better than some people. That's crazy.
Probably went speed limit too.
Alex is losing an eyeball over here.
Lost contact.
He lost an eyeball.
Boy. We're gonna have to do some convergence drills. To get
Oh,
it back.
God.
He should have
It's
done that
going
a
back.
while ago.
And there we go.
Contact's such a. I don't want to ever have to deal
I'm
with
so
that.
only, I'm supposed to only wear one, but I only
You're
wore
supposed
it.
to be monovision, man.
Yeah, that's typically
Yeah,
what I am.
Yours is not that strong, though, right?
No, my
Why?
worst, because my worst, I think on this side, it's my right side is like a 0.5 or 0.75.
So here's a little tip since we're just meandering. We'll give you some health advice. So monovision can basically show up a couple different ways. So the most common one is somebody has LASIK surgery. So when you have LASIK, obviously they're taking off layers of your cornea, so that creates for somebody that has glaucoma or cataracts, can help with clarity of vision, but then you lose a lot of your depth perception because you're basically losing the density of the lens itself. So what they'll do with a lot of people is put them in monovision contacts. So like one eye's far, one eye's close, and then your brain, through the what chiasm?
The optic chiasm?
Oh my God. Where it relays, it's going to cross that, and then you get some information that's binocular, but it's not true. So what we see with a lot of people is, and that can be in contacts, it can be in glasses, it can be in wearing one contact for a variety of reasons, is that if you do things like running or riding a bike and you do them for a long period of time, your brain starts to have a harder time basically processing this like far along from not true binocular vision. We actually had a guy, I think I talked about him on this podcast before, that had bailed out of every 100 miler at about the same distance, around 75 miles, not based on any fitness, he's not the most fit guy in the world, but I think he'd push through it.
Yeah.
But he would literally go blind. He would like white out. And he would say his vision would just start to go. And then I asked him that question. He's like, I do have monovision. I did have LASIK. And I don't know. I don't think he's around 100 miler since that. Because it was, I think, last year. But it's very common for people to have depth perception and balance issues with monovision. They're never told anything about that. So I just think it's kind of one of those things that if you're going to have a surgery and then they want to slam you in contacts, they should at least tell you that might be a possibility. But kind of like the whole, in my opinion, the world of behavioral optometry is kind of like looked at as functional neurology in our world, like a little like, I don't know. I would assume that a lot of, ophthalmologists and, eye surgeons probably don't, maybe I'm wrong, don't think about the movement kind of visual connection as much as I think we should. So if you're out there and you're looking through one eye long and one eye far, I don't know, check your balance with one eye open and then the other eye open and see if it changes drastically. Or if you're running, we always ask people when they're having issues, like if they are in the office, they have contacts, and then a lot of people will not wear those things when they bike or run. Your visual acuity and your feedback, your, depth perception's off. So like you can have mismatch, and I've just seen stuff show up like that. So something to think about.
I put mine in only during baseball. That's actually the only reason I got it.
Yeah.
Because I started noticing that I
couldn't see.
Yeah, I couldn't see the spin on the ball because
Yeah.
like I was facing pitchers that I guess like that was like my 10th grade year.
Mm-hmm.
I was facing pitchers that I had seen like since middle school, and I started just like missing pitches, and I was like, I should be hitting that. Like I'd either get under it or just like completely miss it. And then actually, fun fact, I only hit one home run, and it was the week after, in like the next game
That you got your
that
contact?
I got my contact, and a guy put it right down basically right down the middle, and I hit it dead center. That was my only home run. So I was like, contacts work. One contact works.
And you guys said you didn't know. You've seen Major League.
Yeah.
Okay. Ricky Vaughn. Yeah. He gets the glasses and starts
Give him the
zipping it
ear.
down the middle. Yeah. Anyways, that's what I think about. Any other updates with the crew? Some personal stuff? I
think so. I guess you could talk about your race or the race we got this weekend.
Yeah.
Oh, yeah.
We'll go into events. Yeah.
Yeah.
That's our first thing.
We have the rump shaker,
Yep.
which it used to be down by Sloss Furnace, and now I don't know how long it's been at Regents Field, but most of those races downtown are at Regents Field.
Is that a track shack race? No.
I think it's BTC.
Oh, okay. Yeah. So basically, yes.
Yeah. It'll start and finish at the baseball field there. I think there's 1,400 people signed up. Now there's also a virtual, so there's probably like 1,000.
Wow. That is, man.
There's a 5K and a
I
1
feel
mile.
terrible for the barn burner registration now. Like scratching 100.
Hey, I just got a text from a guy who's looking to come here yesterday that said that he's going to be running, him and a friend are running the barn burner.
Yeah,
He hasn't been a
we got like
patient
6
here
signups, which is the most we've had this early
at this point.
because
Yeah.
they pour in the last like 2 weeks. But
One of my patients actually has hip pain right now, and I was like, that's how she heard about us, and she actually heard about us because of a sign that's posted like on 41. She saw the thing and she goes, "Yeah, my friend was just like, yeah, we want to run like a 10K or a half marathon." And I was like, "Oh, which one do you want to do?" And she was like, looked up at my board and goes, "Actually, that one right there." And I was like, "Really?" She goes, "Yeah, it's actually how I heard about y'all. Was I saw the sign down there, and I was like, let's get you ready for it."
I put that sign up at the new Peavine, or sorry, the new track of Belcher up there. 3 hours later, I put it up. I get a text from FJ/Fat Joe. "Man, you marketed earlier this year, Dr. Burner." Burner. Like, damn right, FJ. So he works for Shelby County, and they kind of partner with us. And I was thinking he was going to tell me that's a little too early to put that sign out, but I mean, it's helping the park. So, but yeah, we have 6 signups. And what else was I going to say? Sloan might run the Rump Shaker this weekend because her friend's training for her. Ran a half marathon or training for one. She wanted to run a 10K, but they might go do that. I don't know. So
I asked her if she was going to be there, and she said no.
Well, she's not supposed to be there. Her friends are coming to town for the SEC championships.
Yeah.
So they're all going to be here, but then her friend has to run. So then they might go down there. I doubt they will because what time does it start?
7.
And they get in at like 6 p.m. Friday. I'm assuming there's going to be shenanigans.
We're going to be there 6 to 6:30. So.
Yeah.
I also found out they're supposed to be, I don't know. I got some patients. One of them is her cousin's coming into town because he's like, I guess, racing, and like there's a motocross thing that's happening at Regions Field that afternoon.
My buddy's going to be there. Yeah.
Because I was like, when is that? She said Saturday.
No. It's probably Protective Stadium.
Oh yeah. She said it was one of the ones downtown.
Yeah. They've had that there.
Oh, they can put a motocross
in the fall. There? Yeah, they had 2 there last year, I think.
Wow. So Regions Field is where like the Birmingham Bowl was this year, where Legion Soccer plays.
That's Protective.
Yeah.
Region is baseball.
Yeah.
Birmingham Bears.
Oh, sorry. Yeah. But no, the motocross is at Protective. Yeah.
Or UAB. Yeah.
Bigger bowl.
Besides that, same weekend, we have 2 things going on the same weekend. So we have DNSA in Nashville, which I think we're sitting at 12 signups outside. So like myself, Seth will be there. Dr. Audra, I think both of her other doctors will be there. I'm pretty sure. So there's 5 of us. Sloan will be there too. So we're going to have, we're almost up to 20 with the Shed Fitness crew that's there. And then I'm hoping we get another 5 or 6, and then it'll kind of be a full house. And luckily or unluckily, we have to bring our own chairs all the way from Birmingham, but it's a whole nother thing.
I'm in charge of them. So if I don't come,
it's a good thing you got standing, buddy.
We only got 10 or 11, so I don't know. We'll figure out what to do.
I'll only be able to get 9 and be like holding one out in the interstate.
Same weekend, the Oak Mountain Running Retreat, put on by our friend Jonathan Croy and whatever the multitude of his companies are called now, Finish Line Catering, and I honestly don't know what else. Yeah, there's a lot of them. Finish Line Catering is the bigger one, or the main one. But there's a bunch of speakers. We talked about Corey Waltering. Alex is going to be out there doing a talk and leading a hike. And what else we got? We got somebody. God, who are the other speakers?
There's 4 on Friday night.
But bunch of information on Facebook. Jonathan Croy, Finish Line Catering. Another thing that I saw they're putting on with Xterra. So the Xterra North American Championships are third week in May. So 21st this year, sometime around there. But that Xterra, basically the director of Xterra is moving to Birmingham, Steve Andrus. And then via that, they're going to be doing more stuff in Birmingham because Oak Mountain's a nationally recognized park. Like, it's absolutely huge. It's awesome. So they're doing the Appalachian Trail Fest or Appalachian Trail Fest in October or September. And there's, I should have brought up the website, but it's a 15 and 35K, which are the national or world championship distances for the Xterra Trail Run. So they used to have a trail running. So Xterra used to go Friday, they did all the talks and stuff like that. Saturday, they did a triathlon, both sprint, the X-Ticer, the sprint, and the full. And then Sunday, they didn't have the short course triathlon thing that's televised, and they had the trail runs, and they would do 5K, 10K, half marathon, or 21K. And that was the world championship distance, was a 21K. And then they started adding on the marathon, and they went into these ultras. So I don't know why it's 15 and 35, which is neither one of the previous distances. But so I'm glad they're bringing that stuff back, but I don't know. I think I saw that the world championships in the UK, if I'm correct on that too. So it used to be in Kailua, Hawaii, where I went to it in 2016, but I think it moves every year. Yeah. And then again, the World Championships for Xterra Triathlon will be here next year. So we have the North American Championships 2 years in a row, and then World Championships will be here, or maybe 28. It's either next year or 28.
So where do they typically have the North American Championships?
It moves. I think it's moved every year. I think last year was Italy or Spain.
North American?
Yeah. North American?
North American. So
is it always here?
No, it used to. Again, I'm going to get some of this wrong. North American Championships were always in Ogden, Utah. And then that's the World Championship is always in Hawaii. And that's how it just went forever. Then they moved, I think, the North American Championships to Vermont for a year or two, and then it came into here. And now I think they're trying to set up the continent or regional, whatever they call them, are going to stay, and then the World Championship will move around. I think is what Steve's saying, but who knows? I don't work for Xterra.
Vermont would kind of suck. It'd probably still be cold.
Killington, yeah.
In May?
Well, I think the World Championship for trail running is in June, and I think that's where the Vermont one was. I don't think the Tri was.
That'd be nice.
The Tri still was in Hawaii. Yeah. And those are on two different islands for the triathlon and the trail run. They were during different times, which I always thought would have been better to have them at the same time on the same island.
The Pacific's still cold.
Oh, yeah. For sure. But it's cool. They put on really cool events. I mean, the one here is pretty big. The one in Hawaii is gigantic. And that company's changed a lot since, we first started working with them. That's the first year we were in practice. The first year we worked the events. So yeah, they're changing quite a bit. So we'll be doing some more stuff with them. In terms of events, right now going on Southern States 200. They actually have a live feed that Alex Morrow, the Resolute Running owner and coach, is putting on. I've actually checked up on that, but that started yesterday. Yeah, Wednesday. So it'll go all the way through Saturday, which or Sunday.
Is Jim Walmsley still running?
No. Was he?
I'm just asking.
No, not Southern States. No.
Oh, I was
Southern, not Western States. No. Yeah. This is David Tosh race. Yes. So this goes from Georgia to back to Alabama for 200 miles and point to point. They're trying to build this race up to be because there's a 200 and 100 that you can do. It could very easily be a Western States qualifier, but then you have Eastern States that is like the premier East Coast race that's like the mirror of Western States. But I don't know how big the field was. I think it was, I want to say 30 something.
Can't imagine.
We'll see. Pretty crazy. But yeah, 14 aid stations, point to point, 200 miles, or you pick up halfway at the 100. And that started today or starts Friday. I can't remember which one. But anyways, yeah. So check that out if you're local. David Tosh, Southeastern Trail Series, Southern States. And then the start of the Southeastern Trail Series, Tranquility Trail is April.
Month.
No.
Oh, maybe they moved it to April.
Second week in April, I think, is what it's pegged as. Here, I got it right here.
I think it goes April, May, June.
Last year was
April
March.
19th. So it's a little bit later because Lake Martin 100, which this may be the last year of Lake Martin. That's what they said, maybe. I don't know if that's true, but that's April 5th. And then Tranquility Trail, April 19th. And the next one's Run for Kids, May 3rd. And then it kind of starts going. And then, Xterra is May 16th through the 18th this year. Yeah. So a lot of stuff coming up. April, May gets super busy. And then everything dies off in June around here because it gets so hot in terms of racing. But that's why we have a race in June.
All right.
Yeah.
April 19th, this should be my,
that's your triathlon.
One of them.
Tranquility, yeah. All right. What do we got? So it looks like Ethan Strand's got some more news.
Oh, yeah. So we had NCAA.
Well, tell everybody that, in case they don't know and they're listening, who Ethan Strand is real quick.
We've been following Ethan Strand for the last few years, and it's just cool to see one of the top collegians now and soon to be professionals who ran at Vestavia Hills High School. His dad, Scott Strand, on the Track Shack, a local Birmingham guy as well. And so him and his family
Olympic trial guy as well.
Him and his family been around for a while.
Marathon?
Marathon and steeplechase.
Yeah.
3K steeplechase. And then Ethan ran in the Olympic trials last summer for the 1500. This past weekend at the Indoor National Championships, he anchored their distance medley relay and got second, which was a really good race. The fact that you get second and split 3:49 on the mile leg, and the guy in front of you just happens to split 3:48 is pretty crazy. And watched an interview with him after that race, and so he won the 3K the next day, his first indoor title, and he basically just said, "Hey, I learned from I went too early in my kick the night before, so he waited a little bit and closed. He closed his last lap in 25:3." last 200 meters and 25.3.
His kick is world class.
Yeah, it was pretty insane. So it's just, again, it's cool to see him doing well. Their team scored pretty well too. And then Sam Ruth, I'm going to say is how you pronounce his last name. He's Australian.
Ruth with an E.
Yeah. Ruthie. He this past weekend broke Jakob Ingebrigtsen's age group world record as the youngest person to ever break 4 minutes for the mile. So if you've been following him, I recently just saw him in social media in the last few months, but he ran 3:58.3 at 15 years old, 11 months, 6 days. So previous record, I think Jakob was almost 17 when he ran 3:58 point something, whatever. So a full year younger than him. And if you are in the track and field world, you know the name Jakob Ingebrigtsen. So it would be, be really cool to see where he goes in the next few years. I feel like there are plenty of guys that we've seen run well at a young age.
Yeah.
Do they always pan out? Tends to favor men better than women, but you never know. So
I think in the, in the mile like that, if you have that kind of speed, because we know speed is basically going to be gained or, bought basically early in life, and then you can build the endurance on top. So I think that pans out better than people that are like really good at cross country, the 5K and stuff. And then maybe you already have
running
quite
high
a bit
mileage.
of endurance and So I don't know. I think being, a standout in the mile or something like that maybe has some more carryover into later in college and stuff like that. So I also see any talk where he's going to school.
Oh no, I didn't. Well, I mean, he's a sophomore.
Yeah, but I'm assuming he's talking to people, and I'm sure it's going to be in the States. I would assume.
Yeah, maybe. And honestly,
I think in cross, I need to put this up to my mouth. I think in cross, you can't talk to people until they're like a junior or senior.
Oh,
yeah.
Because that's different. Like baseball, you can reach out super young.
You can reach out to them. They can't reach out to you.
I think you can reach out to them at junior year. Coaches can't talk. Coaches can't reach out to you until I think your senior year. If I'm not, at least when we were
that's
going.
What I remember.
I think we're fixing to have our 10-year high school reunion. So I mean, things have changed.
Yeah.
Oh yeah.
Get your walkers out. Yeah.
Get your walkers.
You have yours?
It's folded up back here.
It's got to be rusted by now.
That's not a golf club. That's a cane.
I can't believe it survived the fossil age.
I know. Yeah.
Petrified wood.
First edition walker. Yeah. It's made of mammoth bones. But did you see the woolly mice?
What?
So they took the genes from the woolly mammoth and used them in mice to do the first. This is what I saw. Maybe this isn't true. Who knows what's true nowadays? Who knows?
Is that basically an ROUS?
What?
Rats of Unusual Size, Princess Bride?
I get the reference now, but I was lost there at first. No, they weren't any bigger. They just had woolly, long brown hair. So maybe that's
we need to stop playing with stuff.
Oh,
we need to stop playing with
now.
stuff.
I agree.
Genetics?
I agree, but I would go to Jurassic Park.
Oh yeah, those little like hamster balls that get to drive around in there.
I don't know about that.
That's dicey.
Have like a T-Rex claw go through it.
Yeah,
they'd be kind of.
I'd for sure go though.
Oh yeah, I would go.
I'd have to. Yeah. Even if they were 50% chance of dying, I'd be like, okay,
having a pterodactyl fly over you.
Yeah. But completely switching subjects, back to my cane in the golf club. One thing I didn't mention, since we were talking about just kind of the sports updates, Rory McIlroy back in the winner's circle after I don't know how long. Well, I guess he didn't win. He won not too long ago, but not a big event, even though this wasn't a major. So won the Players' Championship in a Monday playoff against JJ Spawn, which JJ Spawn just has resting, basically, I guess, upset face, not bitch face, because you would hear him talking and he was like, oh, hey, all happy, but he just looked pissed. But yeah, he fell apart on the Monday playoff and it was just a runaway. But that being said, now there's all this talk of Rory's going to win the Masters and being picked, which I kind of like to see him win, even though I do think Rory's a bit of a dick. I don't know. I'm sure everybody saw they took the Texas Longhorns golfer's phone from him. Did you guys see this?
No.
So first or second day, he teed off, and somebody right before he teed off said, just like the 2011 Masters or something, when he basically choked. And Rory tees off, picks up his tee, heads back puts the club in his bag, goes over to the guy, goes, let me see your phone. And the guy goes and hands him his phone. He just walks off.
I like it.
Later find out that guy plays golf for University of Texas. So then the coach has to make a comment. The guy wrote a letter to Rory and the PGA and all this stuff. And then it's like, was Rory being a dick? I mean, the guy,
I kind of wish he'd have just snapped it.
I don't know.
they need to be fined.
If they do something in their swing, I get it, but the guy wasn't like yelling in his swing as something he said before. I think that's, because you'll see people stop all the time. He stopped on the last day, like in the middle of super windy on the drive on 17, I think, and somebody was saying something, he just like pulled off. But anyway, so he's back in it. Also, the crazy thing, they were doing these comparative analysis on earnings, like basically inflation. What am I trying to say? So back like when Arnold Palmer won versus now, like if the inflation rating was the same, or consistent, but then seeing like Tiger Woods, his one, I think it was close to, I don't know what it was, close to $1 billion, or not $1 billion. It was 100 million of winnings total. Obviously he's got way more money than that. But then Rory was right behind him as a second earner with not as nearly as many winnings. But then they looked at somebody like Tommy Fleetwood. He's never won a PGA event. And he still earned 25 million. So it's crazy amount of money that they used to win versus what they win now. Because I mean, the winnings for the players, I think 3.6 million for the first place, something like that. I mean, it's just wild, like how much money is in that.
It's like,
there's a lot of money in golf. I also saw Auburn now has a $14 million golf facility for the college golfers.
I need to go back to college.
Yeah, there's some money in them.
Golf would have been so much more fun than running.
Yeah, except if you want to run at Auburn, you have to have unrealistic walk-on standards and then not live up to it in college.
Yeah, but like so much
See
less
if they got a
painful.
team to run next year.
You just mentally get torched. Okay.
Yeah.
That's like every day in here.
Yeah. And the cool thing with golf in college is you can go play in like pro events as an amateur.
Yeah.
And be like kind of building, obviously not winning money. Because who was it last year, 2 years ago? Oh, it was Nick from here, Dunlap.
Oh, yeah.
Right? Won, what tournament did he win?
It wasn't the FedEx. He got invited to that.
No. He won a tournament and couldn't take the winnings because he was still amateur status.
That's right.
And then he didn't declare for, everybody's like, why is he not declaring? It took like 2 weeks, I think, talking with his agent and stuff, and then he declared pro status. Yeah, it was like $1.4 million or something.
Hey.
Sure, he's made that up in sponsorship. But and Nick Dunlap's a local guy here, so follow him if you haven't. I think that's it for our kind of just events, updates, happenings. I only have one research article that I looked up because I was speaking with somebody the other day that, and actually there's two things, so I'll talk about at the same time because it was the same patient visit. She said, I had all this pain start right when I started going through menopause. She's like, both my hips started hurting, my shoulders started hurting. Her main complaint was she had neck pain that was kind of radiating to both shoulders. And she goes, it's worse at night, but then I'll wake up, it's stiff, it gets better through the day, and it's worse at night. And that's kind of the pattern. Nothing's changed in terms of activities. She used to do CrossFit. She's now gotten away from CrossFit because she thought it was just too hard on her body. She's in her mid-50s, late 56. But there was a couple interesting things. So I was trying to explain to her that, well, when you go through menopause or you have some sort of hormonal change, you change your pain sensitivity thresholds. And so there's just an article that I'll put in the show notes titled The Role of Sex Hormones in Pain-Related Conditions. So when you go through menopause in particular, you get a reduction in both testosterone and estrogen. And the first one that reduces is actually testosterone because that's a precursor to estrogen. So when there's a lot of research that shows that men have a higher pain threshold, which I know a lot of women would disagree with from childbirth, maybe guys too, because of the amount of testosterone that they have. So then as we see testosterone lower and then your ability to basically produce estrogen, that we see that you have a decreased pain threshold or increased pain sensitivity. What she was told, and this was the next thing I was going to talk about it towards the end in these common questions, then she went through this laundry list of what she was told by her primary care physician. The first thing was, without doing any labs on her hormones, they just, because I go, well, have you done any hormone replacement therapy? She goes, well, I tried topical testosterone for 6 months and I didn't see any change. And I go, well, why did we do that? She goes, well, my physician told me to just try it and see if I liked it. I didn't want to dig into it anymore. I want to be like, you like it? Like, you feel better? Should we not base giving somebody a topical hormone based on need versus how you feel? I get that you can have mood alterations, energy, but do you need, somebody might not need vitamin D and have all the symptoms of vitamin D deficiency, and we give them vitamin D and they get toxicosis because it's fat soluble vitamin. Like, that's stupid. Right. So that was what I was like, okay. Then we dug into the, why did she quit CrossFit? Well, she had x-rays of her neck. And then a DEXA scan, and it showed slight osteopenia, right? Female in America, even though she's working out. And she has arthritis. So she was told her joint pain, these multi-site joint pains that showed up the exact same time as menopause, were arthritic. Her arthritis was because she's been active her whole life. Never played a professional sport, didn't play collegiate sport, didn't do anything one in particular. Yet her being active caused her global arthritic changes, even though she's in her 50s. And then she was told that she shouldn't do any heavy weightlifting or impact things because of the joint pain or the arthritis and osteopenia. So when she told me all that, then I had to open my mouth. I wasn't just going to sit there and be like, oh, yeah.
Here we go.
Hey, will you shut that a little bit? You guys we all turned into ghosts there.
Let's say it's
So the way I address this with her, I go, when she brought up all that, I go, okay, well, let's just kind of chat about, because she's like, I don't do jumping anymore, like, box jumps and things like that. I don't lift heavy weights. And she goes, I only lift 8 to 10 pound weights. I was like, okay, well, we know for a fact that loading the skeletal system is the thing that you need the most. Nutrients and load go hand in hand, right? You need nutrients after the load to kind of replenish or, have this osteoblastic, clastic, kind of function play out. But you need that to have strong bones. So 8 to 10 pounds, probably not enough load. Impact by itself, we know, is good, but also running has a threshold. You run for a certain period of time, and then that kind of stops or goes backwards. And then it's, bouts. So I do 3 miles, a couple times a week or whatever. That's kind of that sweet spot or time, I guess, for improved bone density versus a detraction. That's also only lower body, right? You're not getting anything upper body or spine or whatever we want to say. So we told her about how hormones can change. And then as we're going through this, she also had a bladder sling surgery, I want to say 6-7 years ago. And she goes, well, it worked. And I was like, oh, so no incontinence with jumping or anything? She goes, no, like I can jump just fine. So here's somebody that was active, that was weightlifting, that was jumping without any of the typical things we see in a female of this age. And everything that she should be doing to actually help her, they literally told her not to do.
Yeah. Is it just, do they say that because they think, well, they could risk falling, breaking a bone because they're osteopenic? Is that
probably,
what they're...
I shouldn't say probably. Maybe. My thing is... I know where the thought process goes wrong is them telling her that your generalized arthritic changes and your body degenerative changes, normal signs of aging, right, are because you're active. And that's the one that I tackled first. I said, actually, all the research would show because you've been active, you probably offset that tremendously. And your diet would have, and lifestyle would have like caught up to you much sooner had you not been active your whole life. And especially she's like, I've done all sorts of stuff, tennis and golf and dance. She never did one thing in particular. So like that right there, as soon as somebody says that and then all the other stuff, I'm like, well, if they think that, then they probably do think, you shouldn't lift weights because it causes arthritis. You shouldn't jump because it causes arthritis. What are we talking about? And I address it nuanced and say, yeah, if you don't have great mechanics, sometimes if you have a previous injury, sometimes, because she brought up, she goes, what about pro athletes? They have degenerative? I go, they're the extremes, right? I go, my wife, 2 surgeries on each shoulder. Mm-hmm. Her shoulders are not going to move or operate like yours and I's, but they didn't before the surgeries either because of the amount of stress she put on them. The surgeries maybe were needed, maybe not. Now she's had planned trauma 4 times and she'll have early degenerative change, but she better work really hard knowing that's the case. Mm. And like, there was just all this stuff. I was like, Jesus, how many people are being told this crap? And then this is somebody that was doing all the right stuff, went through a normal hormonal change, and literally is telling her physician and me, that's when all my pain started. And then we're addressing it in a non-functional medicine way. And that's why I was trying to get to her. Hey, we got to rule out the mechanical, see if we can get you to get a little bit better. But I bet there's a big functional medicine play. And I'm not going to dive into that female hormone thing. We got to find somebody to work with her on that. But like, it just blew my mind. That, let's slap on some testosterone cream and stop lifting weights and stop jumping and like what? I mean, not. And again, if it was benign, I'd be like, okay, but that's like you're gonna go the other way, right? Not just I'm not bad, I'm just not better. Well, you're gonna go downhill. So
and she had no signs of those activities were making you worse.
No,
from a pain standpoint.
She just thought CrossFit was too hard on her body. I'm not going to deny, as you get older, if you don't move perfect and you're not the fittest person in the world, CrossFit's hard on people in general because of how it's programmed. Intensity. You get fatigued. You're going through big, complex movements. You've never been trained in those properly. Yeah. I'm not against that. That's why different kinds of gyms. But now here's the kicker. Here's the real one. So there's a very good trainer that does classes at a gym here, Brenda, that is amazing. Like every class is literally different. So if you're a personal trainer out there and you're doing these circuit type, whatever you're going to call it, classes, and imagine every one of them's different. Like that's astounding. She's been doing this for 15 years. She quit doing her classes because she felt like she didn't want to do the impact stuff and she couldn't keep up like with the class because she thought it was too intense. And I was like, I go, what did Brenda say? And she goes, well, Brenda just told me that like if like the squats are hurting my knees or my hips or the jumps, she goes, just do isometrics because that's kind of going to load this. Like she's telling her like something good. And I go, perfect. But I go, I bet Brenda would also want you to kind of like push back into like more aggressive stuff as that's better. So just that like was kind of the tipping point. I was like, you're stopping doing a class that like you have one of the best trainers that I know that's watchdogging a small group and doing a different type of novel class, full body movement up and down off the ground. And you're now going to get rid of that. Like I was like, okay, we're going to talk about this. Cause some people hey, let's get through this visit. Let's get you feeling better. Let's address the mechanical musculoskeletal side. And then we'll start talking about all the stuff that maybe is miseducation or functional medicine stuff. And I just wrong. If she never came back, I would still feel like I did the right thing of like open Pandora's box, and I've seen her husband and stuff like that. But the only other crazy thing, I'm not calling this patient out. It's just, this is the time we live in. She had on her paperwork that she only takes semaglutide and then BPC 157. So I was just like, hey, I'm curious, why'd you start taking that? How'd you get
injection?
Yeah. So that's, I go, are you just taking oral? She goes, no, injection. I go, oh, where are you getting it? She goes, I don't know. My son gets it for me. And I was like, son's 19 or something. And I was like, oh, because you can get injectables off Amazon. You have no clue what's in it, first of all, where it's from, if it's even a peptide. So that's, I told Son this, where it gets crazy. And if she's listening, I'm not dogging you. I'm just, I'm telling this for other people to learn. When we went to get ready to adjust her mid back, she's like, well, I've only been to a chiropractor twice. I'm kind of scared to adjust it. And I poked fun at her. I go, but you'll inject things into your body that you have no clue where they're from. And she kind of like snickered too. And I was like, come on. What are we talking about? Because again, Keith Barr on Tim Ferriss's podcast basically tore down the ideas of BPC 157 and 156 actually having changes in terms of like repairing tissue and things like that. He's like, there's changes that are occurring, but it's not remodeling like we think. So go listen to Tim Ferriss' podcast. I don't know where it is in the show, but he talks about how it increases growth hormone receptors, or growth hormone in particular to tendons means nothing in terms of basically making that tendon more robust or strong because they don't respond to growth hormone. So he goes, yeah, they did studies and they just found those receptors upticked, and then they published that showing that's a good thing because there's no correlation of that's an improvement to tendon health. Well, welcome to research in a nutshell. Find a finding and you're like, oh, look, it's good. And you're like, well, does that actually matter? Don't know. Long-winded on that, but I hit to our research article, a common question that I had on the arthritis, and that one just drove me through the wall of being active your whole life is bad for you. No, I don't think so. All right, moving into cases. I think, Alex, this is yours, isn't it?
Yeah.
So this is a mouthful, so I'll let you go for it.
Yeah, I don't have a lot on it because I've only seen him once, but he would be coming back tomorrow. Was a current patient, was a patient of Daniel's. I don't know how long ago, maybe a year or two. This is an 11-year-old boy who he came in because he was having back pain, and he had seen Daniel for like knee pain. He's active, doesn't necessarily play on sports teams, but likes to shoot basketball. Big video gamer though, so it's like he'll play and then he's sitting for a long period of time.
So he's like everybody else. Go to your CrossFit class and sit at work for
I don't know why I feel so terrible. I got an idea.
When I was looking through his notes, I had seen something. I was like, oh, this is different to me. So I'm obviously going to talk to his parents about it. But they had mentioned that he had congenital diffuse venous malformations.
Like multiples.
Yeah, like his entire body. So whenever I looked it up, it's more common than it'll be small, like a specific area in your body. And when you look at him, you can see discoloration in the veins.
That's what I would say. You can usually see
his face, his neck, his mostly his right side of his body. It's on both sides, but like swelling on his right hand and arm, right foot. And those obviously get worse depending on what he does. And he's had numerous surgeries. And from what I looked at, and his mom had explained, in surgeries that they'll do is it's called sclerotherapy, and they'll basically inject an agent in the veins
Saline,
to get them to scar to then shrink because they're enlarged. Which I'm hearing that, like, man, that sounds super painful, and like I can't believe you do that on a kid. But like, if it's your whole body, what do you know? Now, what I'd seen, they do that more often. Again, on the specific areas, harder to do that for your whole body. But he was basically, and he had said, hey, like I have blood clots pretty often, and so, because initially in my head I was like,
yeah,
is this a blood clot? Which he said, this does not feel like, when I've had blood clots, they've been up in my shoulder or my neck, and they feel a lot different than this does. I was like, okay.
It's terrifying.
Yeah. And so basically this all started, he had, normally he plays video games kind of every evening, but on the weekends he'll play a lot more. And his mom was like, yeah, he played like all weekend. So this started on Monday, and he doesn't know what happened. And so in my head, I said, okay, well, he just didn't move for a while. He already has a venous backflow problem where he can't move blood. Yeah. And so he just sat for a long, hours on end playing video games. Flexion intolerant, low back pain, which as an 11-year-old kid, I'm not really thinking that he has a disc problem. But we essentially just did some general movement, some breathing, and I talked to him about getting up and moving in between. If he's going to play video games, like, hey, just get up and move here and there. That might be go out in your driveway and shoot basketball and then come back, or whatever it is. I gave him a couple of movements to work on just in between. But as I was reading more on it, I was like, well, duh. He has a hard time with blood flow in general, and then he sits for a long period of time. No wonder. And he's even explained that that's how his knees will get if he doesn't get up and move. So we're just explaining the same things to him. And I tried my hand at ChatGPT, which I don't ever do. Literally, my people will mention I had this question, so I went to ChatGPT about it. And in my head, I'm like, that never crosses my mind to think about going and use it. And I went, oh, I asked 3 questions based on what I found, and then the next question, and then built it the next question. No, it was just, I was looking at conservative options for congenital diffuse venous malformation. Because the articles I was reading on, I was like, well, he has had the surgeries. They talk about wanting to avoid surgery if possible because he's so young. And there are a lot of the same things that we would advise and that we can do in here. Low impact aerobic exercise, obviously avoiding prolonged sitting, muscular contractions, especially in the area where they're affected, or if there's atrophy in those areas, compression therapy. And then as far as dietarily, like an anti-inflammatory diet, trying to get more fruits, vegetables, omega-3s, and then avoiding things that would be pro-inflammatory, refined carbs, sugars, which for an 11-year-old kid, like, it's not going to be the easiest thing. But his mom, I'm assuming his mom's very invested in making sure that his health is good and that he's setting himself up well because they've been doing this his whole life. So, yeah, it was just interesting. I've obviously never seen that, and then hadn't even really heard of it diffusely like that.
Yeah. And I'll probably a little bit different, but there's a lot of crossover. Sloan, around her first pregnancy, started having some right-sided like varicosity stuff that was really painful, was the big thing. And then it became more of a visual aesthetic thing after the second. So I've done a deep dive, and actually I won't put the article in this one because I'll do a full video on this as we get further into it and have somebody that can edit videos now. But I've found a cool research article because I was just like, well, I wonder if it doesn't make sense, the mechanism they talk about with this, which his is different, right? He's having basically these torturous, malformations within his venous system versus varicosity. They're saying that the valves are basically becoming damaged, right, due to backflow pressure. So there's a precipitating event that causes valve damage, right? Because they kind of say that you go through a hormonal change, you become more lax, the valves start to, basically collapse and they become dysfunctional. I was like, well, what's precipitating that like dysfunction? That doesn't make sense to me. So I found an article showing entrapment sites of lower extremity veins, and then 6 major entrapment sites based on trigger points. Now we're back into the trigger point conversation. 256 patients, and they used dry needling between 8 to 12 visits, depending on, I don't know what the dependence was on there, at the specific trigger point site that they deemed off of clinical exam, or where they found basically, I think based on pressure, if they got backflow into the vein and things like that, that was measured on ultrasound, not just somebody like, seeing distension or feeling it. I'm not going to quote it completely, but I think it was 91% resolution of symptoms. And that also lasted over a year.
Wow.
By dry needling. So that makes more sense to me, that you're like, oh, you can have neurovascular compromise. We know you can have nerve entrapments. Okay, now you're compressing, a neurovascular bundle, a vein or something, you get backflow, and now maybe that damages the valve. So I've been doing some work with Sloan on entrapment sites, and we've done some before photos. We'll be kind of following that as we go. And then looking at that, some other stuff that I've looked at, which you were talking about, dietary stuff. So I've done a deep dive into varicosities and like what you can do, because some of the things that can make varicosities worse are like heat. So when someone gets in the hot tub, like itching occurs, because what's happening is you get a histamine response within the vein, or really within the artery first. And as that vein dilates, that histamine response comes, and she'll have intense itching and the pain gets a little bit worse. So what kind of didn't make sense to me was, well, if I have vasodilation, we know that for like blood pressure and like general like regulation of blood flow, that's actually a good thing. We want to have vasodilation, which causes constriction, and that like basically is pumping the walls. So I was like, that doesn't make sense either, that you should avoid things that are vasodilators, right? Nitric oxide, heat. So then you take a deep dive into the research, and then you start to find out, well, actually it's just kind of a moot point. It's about 50-50. It's not negative. They just say some people show up with more symptoms of itching, but it doesn't necessarily make the varicosities worse. Then you find research that shows that it actually does improve varicosities. So I was like, okay, so what can be potent vasodilators besides getting in a sauna or a hot tub? And I'm not saying to do that, because there's contraindications, and I can't be the person that's saying it's good. But we have Sloan on the following things. L-arginine, which is a precursor to nitric oxide. And this is an important note. Some people are very sensitive to nitric oxide, like pre-workouts and stuff. They'll get itchy. They have a histamine response or a pump response. But L-arginine, and then you can have beta-alanine, is also a precursor to nitric oxide. They are like second stage vasodilators. So we have her on that. Vitamin D and vitamin C and vitamin E are potent for endothelial health. So that's like for this kid, I mean, he's young, endothelial health, vein wall health, arterial health is going to be paramount. So yeah, you don't want the inflammatory cascade, right? So this gets back into like the cholesterol, atherosclerosis concept, where we're like, the cholesterol is not causing the issue, right? Just like in a forest fire, the wood didn't cause the fire, but you have a lot of wood. So if you have cholesterol present, you're like, oh my God, I got atherosclerosis. No, the spark is like inflammatory responses, insulin resistance. Same thing with this kid. That's, terrible for him. So we got to control the inflammatory response. Other things that we have are on, and methylfolate, endothelial health. A lot of people have methylation defects. I just ran on myself, Kit, our youngest, and then Sloan, all our genetic data through 3x4, because I've already done Maddox's, just looking at everything. Asparagus extract, which again was another endothelial wall or endothelial health promoter, is along with sulforaphane. So I actually found, and again, in the video that I'll do specific on this, I'll put because she's only taken 4 supplements. So it sounds like a lot, but I found things that combine a lot of these things. So I'm doing the soft tissue kind of protocols on her. We got her doing this, we got her doing some other stuff, and she's already seen a big reduction in pain, because that's her biggest complaint, is like pain, especially around, menstrual cycle. And then a little bit of change from an aesthetic standpoint. And then I'm also looking at the aesthetics. The 2 biggest ones are intense pulse light, and then a couple different laser therapies. But then sclerotherapy, like you said, they're injecting saline into the vein to kill the vein, thinking that you'll have an angiogenic response and basically just form new veins around it. Still doesn't. And what do most people see? That they change and you get more varicosities, probably because you're not finding out why. What doesn't make sense to me is why is Sloan only have on the right, not the left? That is not a systemic vein wall, elastin breakdown issue. You have something going on, and she's always had right hip symptoms. That was the biggest pain point during pregnancy or delivery for the second. So it just got me thinking. So we'll see what we find on that, but just kind of poking around and questioning some of the long held stuff of like, don't do this, or this is bad. And it just doesn't make sense when you think about it to me at all. Your valves are becoming dysfunctional.
Mm-hmm.
it's an autonomic response. So why isn't that systemic? I don't know.
That's like similar with one of my patients that I've seen for a while. She's the one that had the right ACL, like back like in, I don't know, 25 years ago or something like that. She also has right low back pain, and then she has varicose veins on the right that she is having the surgery for in like, I don't know, a couple weeks. Or they're going in and they're like basically like caulking up like her like femoral vein, and then that should like reduce everything on that one, which is
such a dumb idea to me. You know, I don't know. None of it makes sense.
They're stopping it up so that way, like you said, like angiotensin stuff happens, so they like reform or regrow like new veins. And I'm like, I don't know if you're regrowing. I think you're just like putting more force to the capillaries, which are already like smaller, which
I would think would just cause more spider thread veins. And I don't know. I'm not obviously, you know, a cardiologist or somebody that's in that, you know, working with people that are dealing with blood pressure, arterial, venous issues. It just doesn't make sense. And if we've learned anything, is doctors are still out there telling people that arthritis is caused by generalized movement, which is the exact opposite of true. So why not question anything? And then you can dive into the research like anybody else and kind of make your own interpretation. And then if everything's benign, right? But I'll put up that article I'll do a video here in the next few weeks on that research article, what we're doing with Sloan, the exact protocol, because there's a ton of women that like pain is their biggest thing. I've had people where I think the complaint they're coming in for is being caused by varicosities, not like anything else. Then you get into the whole, okay, veins and arteries have their own nerve supply, and they can have their own pain supply, nevi nevorum and things like this. So it's like, you know, where's it stop? What's starting what? And I don't know. So just keep questioning it and think around it, and, you know, don't just take it for what it is, especially for women, because I know it bothers Sloan a lot from an aesthetic standpoint. So that's where I was like, if I could help at all, you know, try it. But because she did a consult to do sclerotherapy, which was 6 sessions, and then they basically say, yeah, it'll probably come back, and it's a lot of money and it's not insurance covered. I don't know. I don't know.
When you start, here's my thing. You start caulking up veins. Like, they
don't put caulk in there for me.
No, that's just what
they're basically stopping the flow.
The reason she said that is because she said that's what her doctor told her. Is it's basically like
they'll cauterize veins.
Yeah, they stick something in there and it like fills it. Does that not like put more stress like on the cardio system? Like,
so you're just, again, they're thinking that you're going to backflow around it. Yeah, divert it. To me, I'm like, well, you have an angiogenic. I mean, you are growing new vessels all the time, right? Through capillary beds and, you know, out of microtubules and stuff. But like, it doesn't make any sense to me. Same thing with radio frequency ablations and cauterization of nerves. Like, yeah, you go under neurogenesis, but the whole thing is like, okay, you're going to kill that nerve to kill a pain response. Like, we know enough about chronic pain now to know that you're going to have the same response, and maybe worse because you're already having an angiogenic and neurogenic response to that, because that's what happens in chronic pain. You grow more nerves and capillary beds because your body's kind of saying like, I have a lot of feedback going on. So like, that's the response. You get more stuff. Just like you load bone, you get more bone instead of less. Yeah. Welcome to degenerative change. Like, I don't know.
What were did you ever say what were the 4 things that Sloan's found that if she takes those 4, it hits a lot of the...
I'm going to do a deep dive, and I'll give the whole supplement list and that. But I'm going to do a standalone video on, again, showing her before photos, if she's okay with that. And then like what we've done, because I've dry needled. Sloan does not like needles. And one of the spots is literally like right in her hip flexor, like pectineus, which is not a fun area, but that's where basically your femoral nerve, artery, and vein come out underneath your inguinal ligament there, and that's not a fun spot. So it's been a lot of soft tissue, and I think you can use, again, the mechanisms of dry needling are not well understood, of like, why does it work? Does it work? Is it the best tool? I think you can do a lot of hands-on stuff, but a lot of things around the inguinal canal and obturator canal on her, or obturator hiatus, is where symptoms are. Makes sense because her worst varicosity is right across, like, you know, medial thigh. Yeah. So we'll just see. But I know a ton of women that if we could help it all, but like, I'm being honest, the only thing I've ever heard about soft tissue and varicosities comes from, I think her name's Ashley Black, and that damn fascia blaster thing. You know what I'm talking about at all? This lady has been sued 10 ways a Tuesday. Oh, gosh. So it's a saying that they would just fascia blast all over, cause massive bruising and things. And then she started advertising it for varicosities in particular. And I'm not saying she's not a doctor and you have to be a doctor, no shop, but she's just a lay person that got into fascia stuff because of varicoses and cellulite, saying that if you look up fascia blaster, if you've never heard of this, which is a terrible name because it just takes your brain in a whole lot of different places, but Ashley Black, and she had a documentary about it. She got sued, like, I want to say $10 billion worth of lawsuits or something.
Would there be
for people that bought it, didn't work, or had adverse reactions?
So
maybe I'm wrong.
Chance of an embolism with that?
Yeah, that's what I'd say. Yeah. So that's, again, we have people, I think it started with cellulite. So again, let's look it up a little bit while we're on here. So Ashley Black was definitely the creator. And if we get in here, I bet if I type Ashley Black, Ashley Black, fascia blaster.
Massage.
Let's see, lawsuits, class action from 2021. The court, because the company offers 1,000-day money back guarantee. That's a long ass. So there's Ashley Black. Lawsuits presumed to be just one aspect of various attacks on Black and her companies. This sounds like they're on her side. Being that the fascia blaster is FDA registered, does that mean that it's a certified class 1 medical device? Okay. To date, neither FDA nor Black's companies have received a single verifiable injury report. Okay.
Fasciology. There we go.
She made that up.
The
too.
source.
That's what's up.
Yeah, source, related links. Ashley Black, guru. She wrote this article. No wonder it's on her side. Yeah, welcome to Ashley Black. PR genius. But yeah, I remember in the documentary, she came up with the fasciology. She was
only
sued
3.4 ounces.
Probably 1,000-day warranty. I don't. And again, I'm not going to say that she is wrong because we don't know enough about what we don't know. But all I'm saying, $175 million lawsuit is that one right there.
It says she was sued actually, but it was dismissed because her product has a 1,000-day warranty. So you can give it back in 1,000 days. She has like a 3.5-year warranty on that thing.
So I wonder when that warranty went into effect. Like when and the complaint cycle, which 1,000-day warranty, you're either thinking one of two things. It's an amazing product and you're that confident that I'll give you 1,000 days to use this thing, or there could be a lot of problems. I want to make sure you got 1,000 days to return this thing and get off because I'm assuming if you return it, you waive all rights of, coming at whatever. I'm not trying to watch. I'll probably get Ashley Black.
You better get
people coming at
blacklisted.
Me. But this was a huge thing like 8 years ago or something that she was just like run amok with fasciology and all her fun stuff. People are just bruising themselves. I mean, like literally to the point where they were like black and blue from bruises.
Yeah.
Look that up. Another fun thing, the fasciology and all the fun, which takes us back into the fascia stuff with somebody that might be coming on the podcast here pretty soon, but we won't get into that for right now. You got a case or anything you want to talk about? We kind of rambled. We're hitting the 10:45 mark here, which is usually our shutdown because we start seeing patients at 11.
I might have a fun one, but I'll do it like the next time.
Yeah.
Because I want to see like a couple more visits.
Yeah. So look forward for a few things. There'll be a video coming. I have 2 long form videos that'll be coming out. One on varicose veins, as that pertains to kind of musculoskeletal entrapment sites. The other one that'll be coming out that might come out before or after the podcast that I'll be doing that I was kind of alluding to is I basically went through all of the research from the early 1900s to now on trigger points, peripheral and central sensitization, and then also getting into pain and movement, like how they interplay, and literally walking down a timeline of like where we're at now from what is the consensus. There's no law with that. Medical laws or like human biology laws are also laws as we stand from the knowledge now. So I say that because there's nothing being proven with that research. They're not saying, oh, this is why trigger points happen. This is what's happening with pain. This is myofascial pain syndrome. It doesn't. What they're saying is this is the most commonly held consensus based around this. And I think stuff is poorly understood. That's a whole talk I did in Florida last year. I think if we use the current research as it states rather than what people are telling us or what we were taught maybe in school, you're going to have better results. And we talk about that all the time in here. But I will be doing a long form video on that, maybe even a class for professionals on that. So look for that in the next month or maybe 6 weeks. Outside of that, if you're listening, hit us up with a 5-star review. Maybe tell us what you like, what you don't like, maybe less of the don't. And we'll see you next time.